I'd like to introduce some other people. We have also Jamie and Fred Jaskowicz from admissions, so anybody who has a question about that, you can talk with them when the time arises. But right now I'd like to introduce you to our Director of Nursing, all right, Edie Willette, and Sue Turner, who is our wonderful person who keeps everything together in the lab, and you'll grow to love Sue. So if you guys, when you're presenting, could stay somewhere right between here and there, then you'll be on the camera, okay? Okay.
Welcome.
Hi.
Everyone. So the first thing, while Sue is kind of setting up here, I'm going to just welcome you to the program. First of all, congratulations for getting into the program, because you all know that it's very competitive, and you should all be proud of yourself. I know some of you are coming in the fall, some of you are coming in the spring, and so we're looking forward to meeting all of you. As you know, because it is competitive, we pick the best of the best students. And I want to assure you that you are coming to a very highly recognized nursing program. And I want to dispel any kind of myth or rumors that are out there that you're not going to find a job, and that's not true. Okay? Our graduates are finding jobs, but it is getting a little bit more competitive in the job field as well. And that's why you will hear from this day going forward that while you're here and you're getting your education to sit for the NCLEX, you will also need to keep in mind that the next step is the BSN. Okay? So always keep that in mind. All right? For those of you who come in with a degree, a bachelor's degree or a master's degree in some other field, make sure that you check in with your advisor periodically if you're thinking about taking other classes along the way. I'm actually suggesting maybe a summer session, not while you're in the nursing courses, okay? Which leads me to talk a little bit about what Alyssa touched base on. It is a very rigorous program, okay? And the faculty is going to go over the schedule that you can expect to find when you come into the program. But again, very rigorous. 2 full days of clinical, 1 full day of class. If you have a family, children, a job, okay, all of those things together will compete for your time, okay? So it's very important to make sure that you know who your supports are, okay? Nursing school isn't part-time and everything else full-time. Nursing school is full-time, and then you try to fit those other things in, right? So I would really, really encourage you to go home, talk to your family, talk to your friends, and really corral that support, because you're going to need it over the next 4 semesters. Okay? I don't want to scare you. It's a lot of fun. It's a lot of fun learning. Okay? It's a lot of fun taking that journey to getting your RN, okay? And like I said, it's fun.
It's a lot of fun.
I mean, there'll be some, there'll be some tears along the way, but there'll be a lot of laughter, and you'll make a lot of friends. And make sure that you are allies with one another, and that you're not competing with one another. It's not a competition, okay? We have a lot of support here. We have a lab, we have tutors, you have your academic advisors. Does everybody know who their advisor is? Yeah. If you don't know who your advisor is, please find out. If you do not have a nursing advisor, a nursing faculty advisor, please make sure that you go to the admissions office and talk to somebody about getting assigned to a nursing faculty advisor. Okay, that's very important. We have notoriously a 90% or greater NCLEX pass rate, so that's very important to know. that measures our outcomes here in this program. And does anybody have any questions? Yep.
So it's a 90% NCLEX pass rate, but what's the graduation rate for those graduating on time?
That's a good question. Our graduation rates, I just did 2013, and it came up to 68%, okay? So what does that mean? We do have some attrition, okay? Where does attrition come from? Folks find out that maybe this just isn't really what they want, what they wanted to do. They found out when they entered into the clinical setting that, their lives were probably going to take a different path. It's rigorous. I'll say that over and over again. It is academically and clinically challenging, okay? So if you don't have your priorities in the right place, sometimes you can find yourself where you have to step out and possibly be readmitted, okay? So 68% is pretty average. That's pretty good. Okay. Any other questions? So before I finish up for this evening, Sue and I would like to explain to you one of the responsibilities that you will have prior to sitting in your seat in either August or January, and that is the health documentation requirement. Did everybody read through that paperwork that you got for admission? Okay. So when do you need to have your health forms in? And what happens if you don't?
Okay, so on this side of the room, you have the fall group, and on that side, you have the spring group.
Oh, okay. So July 1st, December 1st, okay? We are very, very serious about this. So if you decide that you're going to talk to some alum about whether we're serious, they can't answer that question because this is the first time we're implementing this process of health documentation, okay? This isn't our rule. We go to clinical facilities that are accredited by JACO and national health organizations, that if they come into the hospital or the clinical facility that you're in, and we do not provide documentation that you have your immunizations or your flu shot, they will get fined a hefty fine. Okay? Nurses that work in these institutions, if they're not up to date, they can get fired and dismissed the next day. Okay? So these aren't our rules. These are requirements that are from national accrediting bodies. Okay? So please do not test that deadline because you will lose your seat. So the company is certified background. Sure.
I'm going to go through the whole thing in a minute, okay?
Okay.
Yep. So we're going to go through the requirements of what you need for health documentation. We're going to give you information on how to log in to the portal, okay? Instructions, login, and everything that you need to know. From this day forward, okay, it is your responsibility to get these forms in to this electronic portal. And if you have any questions, your questions are directed to the portal. There is 24-hour assistance with this, and they serve over 60% of the nation's colleges and universities. So this is not their first time at the rodeo. They know exactly what they're doing, and they can answer any questions. So if you have questions, please do not call the school, okay? You need to communicate with certified background.
All right, this is Certified Backgrounds website, certifiedbackground.com. You're gonna get all this information, don't go crazy writing stuff down, okay? We have a long sheet, this is the one supplied by the company, and I also put together a step-by-step of how you will navigate your way through Certified Background and set up your profile.
You know what, Sue? Before you start, I'm gonna pass this out.
Okay.
I'm gonna pass it out before you start, so you're paying attention when. So go ahead and take one and pass it out. And once everybody has one, let me know, and we'll start. And then that way, you have it in front of you, okay?
They have a help. There's a live chat. If you have a question, you can live chat someone at the company to answer your questions. You can also, there's IT support, okay? I'm also going to give you my contact information because I've already gotten phone calls from people. And let me tell you, it is very impractical. I can't call everybody back and chase you down. It's much easier if you email me, and I will pop up my email address if you want a quick answer back and forth. But calling me and there's 200 of you, 100 of you almost, it's just overwhelming, okay? So this is their website homepage. Your code is specific to your class, okay? You know someone in 102 and up, don't ask them for their code, say, I forgot what it was. Their code is different than your code, okay? So when you go in here, everybody have something? Not yet? I can only go so far because for this side, I don't have my banner number in there. I would be an administrator, but you'll see where you're going to put your banner number in. Okay? No? Not this banner? Huh? Oh, it's different from the other one. Ignore that. See, I think these instructions are wrong then. I remember that. Because I put the banner number. You're going to have to fix that. It's not banner number. So when you place your order, your code is PG65. Does everybody see that?
Okay, wait, there's still, everybody have this?
Not yet.
Not yet?
It's coming.
Does everybody have the little sheet?
On that little sheet where it says to enter your banner number, cross that out. It's the last 4 numbers of your social.
There is no, you do not need a PIN number. Nope. You just need the TG65, TG65, so it is 65. That's your access code.
So just ignore that then.
And when you log in, you're gonna create an account, but before you create an account, you need to pay $35 for the service. Let me explain something. You're gonna pay the $35, set up your profile, start submitting paperwork. On August 26th, when you come and sit in the seat, you'll get reimbursed. On January, whatever that date is gonna be, I don't know right now, 26th, if you're sitting in the seat, you'll get reimbursed. If you set up the account and you pay $35 and you decide, I've changed my mind, I'm not taking this seat, you will not get reimbursed. Okay? Is that clear? So you will only get reimbursed if you follow through to sitting in the seat. Because we can't pay for people that, don't follow through on sitting in the seat and then pay for more people coming off the wait list.
So they can switch fall, spring, and that will be okay.
That will be fine,
I know you guys do it a lot. So
Does
that,
everybody have this sheet now? So everybody has both sheets?
if you're in fall and you go to spring, when you're sitting there January, whatever,
You will get reimbursed.
reimburse then, okay?
When you're finally sitting in your seat, when you can no longer change your mind. Okay? You can change your mind, but you won't get reimbursed. Just so it's clear.
So for place order, you're gonna start, you put PG65 and hit go. And see where it already tells you down here, help or frequently asked questions, you can go to that. Must be just, oh, okay. Why did it say?
Excuse me.
Oh, because I have to set, I don't, it wouldn't let me go any further. It costs $16. You have to follow, accept their rules, continue the order, and then you'll start placing your order.
Okay? And it's just like anything that you've ever ordered online. It's a secure site. You can pay with a credit card, a debit card, an e-check, and you can also split the cost into 2 payments. Okay?
And there's a live chat and the help. It's on every screen as you walk through it, okay? I haven't actually walked through this yet, but they, as I said, they have a lot of support.
Now to upload a file, okay? Everybody, who has smartphones here with a camera? If you don't have a smartphone with a camera, you can use a regular camera and upload it to your computer that way. But you can literally take your smartphone, take a picture of the document, and upload it. Okay? Yep.
And we only need the document that you provided,
What, I'm sorry?
the document that you provided in the packet, is that the only form that we need to upload? Besides the certification, PR certification?
From what I understand, when you place your order and put all your
Yes,
information in,
it will tell you what you need to upload. It will give you a list of everything, because we provided this list. You wanna,
wait, am I done with this?
I don't think we can show them anything else,
No.
right?
You guys have all seen that, right? It came with your packet? But from what I understand, when you generate your profile, you will, a sheet, like a, you know, when you do a fax, you have a fax sheet, the front sheet. It will have a code on it with your information, they know exactly who you are. Because all you ladies who change your name sometime in the next 4 semesters, 5, whatever, they will use that code to know who you are when you change your name, if you do.
So Sue provided this information to Certified Background. So they have a 3 Rivers Community College nursing program health profile, okay, which also includes your CPR. So you have to provide documentation of a healthcare provider CPR certification,
I'll get to that.
in addition to all this, okay? And they'll tell you if you submitted the wrong form. You can, right.
All right, so everyone's familiar with this form, right? Couple of areas I just want to point out to you. You're going to fill out all this information and you're going to submit that. This part is key. To the examining physician, date of the exam, does the student have an allergy? I amended that with them. You can have an allergy, I just put it down, I put it as sensitive, but we just want it documented. But then the onus becomes on you if you have a latex sensitivity allergy to make sure you have the proper equipment. We're 99.9% latex free, but Foley catheters do have latex in them, okay? For the most part, everything else is latex free. This is the big one. Students are cleared to participate in clinical courses with no restrictions. You need an answer for this, okay? By the doc, okay? That's one of the things I'd like to point out. It kind of gets lost, I think, in this whole paper, and people, I can't tell you how many would submit this with that not completed. You have to go back to your doctor's office and have them fill it out, okay? I know some of you have already gone this path. I've gotten a couple of phone calls, so you may find once you start uploading all your information, you're gonna get what they call a reject. That there's information missing or it's improperly documented, and they're gonna ask for more paperwork from you, okay? This is quite a process. Some people do it like that, some people not so much, okay? So that's the top part of this page. Any questions on that? Measles, mumps, rubella, varicella. Measles, mumps, rubella can be a qualitative or a quantitative titer. That means it can either say positive, negative, or it can have a number. Either one That's fine, it's acceptable documentation. It has to be the actual lab report. The lab report must be attached. None of those inquiries, those queries your doc's been doing, because it's all on an EHR, it's gotta be the lab report, because they'll put MMR and it says MMR positive, positive, positive. It's like, where's the lab, where's the reference points, okay? So those things are gonna be required that you have the actual lab report. So with measles, mumps, rubella, and if your titer's negative, then you have to get 2 vaccines to update, and then you're all set. And certified background will be looking for this information as you go along. You send them a negative titer for measles, mumps, rubella, they will say, now you owe me a vaccine documentation, okay? When you get to, that's measles, mumps, rubella. When you get to the varicella, you have options. You can either give a lab titer, that's positive, physician documentation that you had it, he saw you, okay, right here, or lab, the titer, or you can get 2 doses of the vaccine 28 days apart. So certified background knows that there's some options with the varicella, okay, and they're looking for one of them. If your titer's negative, you have to get the 2 vaccines. So you don't lose your seat because you're in the middle of these series, okay? I heard there was some concern about that. You can continue as long as you're compliant. When you're no longer compliant, we'll pull you out of clinical, okay? Because you're not following through, and that's your responsibility, and we will pull you. So that's the measles, mumps, rubella, and the varicella. Did that answer your question up in the back? Yes? I got it. Okay. I want to jump to the Hep B. If you have never had the Hep B series, you don't have a lab titer. Just never got it. So you will start the series. The series starts 1 month, 2 months, 6 months, and then a quantitative hepatitis B titer 2 months after the 3rd vaccine. Quantitative. I need a number. I need a reference number. No pause negatives. If your facility or your doc's office uses L&M, actually, L&M and Bacchus will give me a number, which I will accept, but a lot of them use Quest. You have to ask them if they use Quest, and if they use Quest Diagnostics, their standard lab sheet does not have quantitative Hep B titer on their standard lab order sheet. You have to tell them to put in code number 8475. I can't tell you how important this is, and how many times you will have to go and have a lab titer drawn again and again. This is a stumbling block for some reason or another. A lot of places will say, we don't do that. That's because you send it out.
2 months after the final hepatitis B.
If you have had the vaccine already, the series, you will get a titer. If that titer comes back negative, you will get the vaccine series again, and then 2 months after the 3rd one, a titer. So if you've never had the vaccine before, you go through the series, 2 months later you get a titer. If that's negative, according to the CDC, I did not make this up, you have to go through the series again. 2 months after that, you get another titer. If that's negative, then your doctor writes a note that you're a non-responder. According to the CDC, you go right here, it tells you to go to this little website, it's all there, okay? So if you have the series, and you get a titer right now, and it's negative, you go through the series again. If you're negative still, you're a non-responder. So, one way or the other, if you're a non-responder, you're gonna go through the series twice. If that makes sense. This is a big stumbling block, it really is, it really is. Because you have to keep up on it, and you can stay in the program again, as long as you're compliant with this, but this one takes up a lot of time, so keep on it, and keep going into certified background, it will tell you and cue you in what's due next, okay? Does that make sense?
They'll actually email you.
Yes.
Email you regularly, all the time. So to clarify what would put you at risk of losing your seat is if you didn't, by July 1st, you didn't start any of these series. You've submitted no shot series. And you don't have your CPR in there, and you don't have, some of the things that don't require a shot series. Okay? That will put you at risk of losing your seat. Okay? Because as you can see, these things do take some time to get up to date. And it's for your protection as well. Because we don't want you to be in the clinical setting not protected from hepatitis B. And so forth, yeah.
As far as the flu
We haven't gotten to
vaccine-
that, let me just keep going,
Oh,
okay?
I'm sorry.
Yeah, that's okay, there's a lot of questions about that. So, are we all set with all the titers? Yes.
Mark, could you just repeat the number you need for requests again?
8475. It's a quantitative Hep B, which means it's a number. And when you go for even, any doctor that's doing labs say this has to be quantitative, it has to be a number.
With the varicella, does that have to have a number?
No, I just said it doesn't, it can be if you have it.
And can
But
that be within the last year, the titer for that, or does that have to be another titer?
Yep. Tetanus, I'm gonna, you know about the whooping cough, and so now it's the Tdap. A lot of, we had a requirement by one of the hospitals, everyone had to have a Tdap, so I had to go. So please, if you are getting current soon, or you see that it says Tdap on it, okay? Because a lot of the hospitals are requiring it. So that has to be, stay current within 10 years. I actually had to tell a student to get her tetanus updated, but certified background check. So I did the Hep B. PPDs. PPDs are a yearly event. Anybody work in facilities, hospitals, you know that, right? You're probably even having T-spots done. PPDs are for tuberculosis. And it's on a yearly event. It's usually planted on your forearm, read in 48 to 72 hours. All the documentation is right here. And that's good for 1 year, then you have to submit again. I can't tell you how many students think that we've lost their information and will send me last year's. It's a yearly event, okay? You have got to keep tabs on it, because this is actually one of the biggest things that the students let go, and we pull them on it. Because of the shortage of tuberculosis, the TB, the vaccine, they've been doing T-spots or quantiferin gold. Those are also acceptable. That information is with certified background. They'll accept any of them as proper documentation for the PPD. If you are someone who had the BCG vaccine or have a positive PPD for whatever reason, you have to submit a current chest x-ray within the year now, okay, that shows no signs and symptoms of tuberculosis. In a year, do not repeat the chest x-ray, but you will have to have a note from your physician stating you will continue to be free of signs and symptoms, okay? So if you usually are negative, if you go through the regular planted PPDs, quantiferin, T-spots, do that. You've had positive, a chest x-ray up front, and then at your 1 year anniversary, it will be just a note from the physician on their letterhead or something stating that you remain free of signs and symptoms. Okay? That make sense? Flu. Do not ask for the flu right now. It's past flu season. It comes back in October, September, October. Okay? I'm gonna have ShopRite coming in. You did last year? We have people have come to the hub, come here to administer them. You'll see the signs for all the pharmacies and everything. You're gonna be tempted to submit a receipt, because you're gonna tell us that our certified background, that's all they gave you. But that's not true. You're signing something. What we need is documentation of a expiration date and a VIN number or whatever, with lot number, and where it's been administered. So you tell them, I need proper documentation, and you're gonna sign something that consents. And the physician, the pharmacist, or wherever it administers, writes where they got it, where they put it, what arm, how many cc's. I need a snapshot of that. Okay, because you're gonna have to go back to the pharmacy and have it there and ask them, I need the proper documentation. So don't ask for the flu now, nobody should be giving it to you. It's in the fall, September, October, when you'll see Dow coming out for the following flu season. Did that answer your question?
It did, thank you.
The last thing is the CPR. It has to be for the healthcare provider, healthcare professional. Good for 2 years. We do not recommend it. I actually put we will not accept from Pro-Life any of those onlines. I know they're cheap at $19.95. However, the small print says that for an initial $39.95, you will go to a facility somewhere in Manchester or Massachusetts to do the practicum part, okay? So we don't recommend that. So if you get it done through your facility, if you're a hospital personnel or something, but make sure if you're in a nursing home or something like that, you probably has Heart Saver, AED or something, that's not for the healthcare professionals, you need to upgrade your card, okay? Make sense? So look at your card and see what it looks like. So if you have to come to the facility, that's perfect. We also offer it through here, continuing ed. We're offering one, August, what is, one on the 29th of this month. They may have capped it already. If you need one right now, plus you need certification, right? Some of you will need research, but if you've never had a CPR before, you need a certification class to make sure you know the difference. We offer them here through continuing ed, and there's a certification and a research course end of August, okay? And if not, that doesn't work for you, American Ambulance. You can go online, it's called, did I not write it? It's American Ambulance, I think it's Pro Training CPR or something like that. And you will sign up for healthcare professional, healthcare provider. You can call there, I gave a number. Oh, that's mine, don't call me. American is 886-1463. Her name is Christine Hildebrand. Tell her I'm a nursing community, she'll put you right in the right course. And I do believe part of it's online and the rest of it, you go there for the practical. That's acceptable because they're around the corner and I can work with them.
They'll do ground class too.
Yeah, but they run them all the time. But start now because they'll fill fast, okay? So through your facility, through our continuing ed, and I work with continuing ed to keep them running all year round, every 3 months or something, I'll let one pop up, we'll plan another one. Especially for you guys coming in the spring, I'll work that out somehow, we'll see if, beginning mid-December or maybe mid-January. I'm trying to try mid-December just to get you guys all done if that's something. Just email me and let me know. That's my email address, sturner@trcc.comnet, comnet.edu. I have a couple of questions.
I'm sorry, where is that? I don't think I have that letter. In what package is it?
What letter?
The one you're having.
Oh, that's my notes.
Oh,
You don't have this note.
Oh.
I can, you don't have a Blackboard Learn yet. So I can make copies and come back, but these are my notes.
just because, for the CPR stuff especially, like, you know, I know, I'm sure I'm not the only one, I'm not certified at all, so that was one of the big things I wanted to find out today is where I go to get that.
Yep.
So I need that
Okay.
number.
Do you know where my office is?
No.
I'm up on A Wing 210.
Thank you.
You're welcome.
Sue, if you forward your, whatever
Instruction?
the CPR, I can send it out as an email, remember you have to check your school email, okay?
It's a
So
2-page thing on all of the
Yeah.
organizations, so I'll
we
send
can
it.
scan them,
All right.
scan them.
I'll send it to you. What else? There's another question. Did I answer your question? No.
Can you take the recertification class if you've had a professional in the past but let it
Yeah.
lapse?
Yeah.
It doesn't have to be current,
Oh, how far out is it?
a year.
Oh, it's gotta be 6 months, I believe is the rule.
Call American Ambulance,
Yeah.
I'll tell you.
But really, be careful that you get in the right one. I had a guy come in, he did through American Red out of Hartford, and it cost him $100. And when he came to my office, I said, I can't take this card. It's an AED. You have to go get upgraded to a healthcare provider. And when he called them back, and it was only within a couple of weeks, they would not upgrade him. He had to pay another $100. So, yeah, please, that's why I'm really careful about making sure I get these instructions correctly. That's an example of one of them. Okay? It says professional rescue healthcare providers. And that's, is that Red Cross? Yeah. So American Heart looks a little bit different. Okay, but it's gotta say those words. Does that make sense? You can say it.
So that pretty much summarizes your responsibilities for working with certified background, getting your health documents up. The message that I'll leave you with today is please do not wait until the last minute. Don't gather your information and then the night before they're due, send it in. send it in as soon as you get them, because if there's a nuance and something's not right, they will let you know right away and you can fix it.
Yeah, don't hold on to them until you have everything. I can't tell you how many people want to do that. Well, I was gonna give it to you when I got my last piece of paper. I don't want, just keep sending it in.
How do you submit what kind of documentation do you want when you get each part of your series? Like, I have to get my Hep B series over, like, what kind of information do you want for each shot?
Whatever they're where they documented. I've taken it on prescription pads or little letterheads. They've taken copies of their document in office documentation where they sign it, and we'll give you a copy of that.
Okay.
Okay?
Submit that.
So we'll have to say 0.5 or whatever, and then we'll tell you what arm and lot.
So you submit it for each shot?
For each one,
Okay.
okay?
So, July 1st, December 1st, okay? Yep.
Okay, you'll send this one.
I am.
Because I need you to see your here.
I am not the one who fills that out apparently. You fill it out, and then I think I might sign it, but I don't fill it out.
I have it all filled out.
Okay. I'll be in my office.
Will you back again?
Yeah.
Okay, thank you.
Thank you very much.
Welcome.
Okay. Sue.
In August. And in January.
All right, so that's a lot of information, right? But what's the key points? Key points, July 1st, December 1st. So really, when I talk to people, I say it's due June 1st, right? Get it all in June 1st and get it all in November 1st, right? So if there's a problem, you still have a month to fix it. And just like Sue said, you get a titer done, we'll scan the titer and get that in. Don't wait to collect everything, right? Because you're only gonna pay $35 once, not $35 each time. Okay? For your CPR, remember American Heart is a 2-year certification. American Red Cross is a 1-year, all right, a 1 year. So most of the time, so make sure it's not a guarantee that it's a 2. If you get a 1 year, that's fine, but then what you need to do is recertify again, all right? So that, just watch when you're doing that, make sure it's for the professional.
I don't recommend American Red Cross. They are not good about keeping up with American Heart Association guidelines and standards. They're okay, but they are not the best. Our patients deserve the best, so I highly recommend you find an American Heart Association, especially through American Ambulance. They're very reliable and very easy to work with.
Yeah. So this is Nancy. Some of you may have not met Nancy already. Nancy teaches nursing too, and really has a lot of good knowledge. They can give you a letter right then and there. They can give you a letter right then and there.
If you have an ambulance there, you only on ambulance where they send you an email, you open it up and it has a little stamp.
Okay. So go back and you have time right now. You can get that all done, right? Okay. The thing is, don't wait for something to happen. Be proactive. Ask for it. Get it done. All right. Get it done. So there's much more to do, but let's take a break from thinking nursing in a second and go to Brenda, Jamie, and talk about registration, all right? Also, there are 4 people here. Now, everybody sitting in this room signed these forms, correct? Everybody signed these forms, okay? There's no one sitting in this room who didn't sign this form. And those people who couldn't find your name, guess what? It was here, so you're official, okay? You're official. So did everyone sign this form? Yes? Okay, all right. Because that helps us to know if there's somebody absent.